Hi.
Hello.
Hi, Gabby.
Hi. How are you, Sarah?
I'm excited because I feel like I'm getting like the insider secret from support workers. Like, it's like, yes, I get to find this. I get to ask you questions that I've always wanted to ask, but I've never have been able to ask. So that's why
Oh.
I'm like, ah. But I love to start this off because we have met before in person, so this
Yes,
is
we
really
have.
cool because
Yes.
I really wanted to dive a little bit deeper because last time I met you, you talked about working overseas and where you learned some really interesting things overseas. Can you tell us your experience for everyone out there listening in today? What was your experience overseas that made you dive into your business?
Yeah. Well, I mean, going overseas and living overseas was definitely part of my journey to opening up my business. But I guess what the catalyst was to choosing to go overseas was that I was working for quite a few years as a speech pathologist in Australia, and I was getting quite frustrated and bottled up with the public
Yeah,
health system because that's the work that I did before I started GRP, was working in public health in a acute ward or in ED as well. And I just felt that I had all these ideas, and everything just felt like it was a push to the finish line to get people in and out.
yeah,
And people really were reporting they were feeling like a number, and that it really wasn't conducive to having that person first approach and making
yeah,
everyone feel like we were really servicing them and their whole worlds and their families. So for me, it was really about exploring something different and seeing how else we were able to think creatively and holistically. And I guess the next logical step for me was fulfilling an adventurous spirit that I've always had in
yeah,
the travel bug, but still progressing in my career, but also seeing what the international public health system over in the UK could really deliver. So I guess that was the primary catalyst to bringing me over to the UK. And my first job in the UK was actually not in hospitals, which I was a little bit grumpy about because it was my bread and butter. It's what I knew.
yeah,
But I guess what fell into my lap was a community role. And at the time in Australia, that wasn't too common within speech
yeah,
pathology. It was kind of always a little mini arm within companies or in public health, but it wasn't an entire service. And to have that
yeah,
experience really opened my eyes up to how amazing the opportunities can be from a clinical perspective. So for me, I loved being able to explore different cultures and religions and different languages and different family dynamics in different suburbs of London. And I just thought, and I mean, the evidence supports it more than anything
yeah,
that if you're providing services in people's homes and in their worlds and in their comfortability, when they're motivated and engaged, the transferability of outcomes is so much more high. And so for me, that yeah, surprisingly filled my cup more than I realized.
yeah,
And yeah, and I guess that was about 2.5 years that I was doing that role. Sort of had my backpack with me and walking around in the sunshine. It was awesome. So that's really what I guess motivated me and inspired me to bring that back to Australia and to
yeah.
start my own business with those values and that mindset in mind.
I feel like I remember my ears pricking up because you were talking about, oh, if I could do this and the excitement and the innovation that I could see from there, how it crept into returning to Australia. So you returned to Australia and you opened up a business. Why?
Yeah. Why is it? Well,
Yeah.
I mean, I think that to myself often these days, but no, I love it. I love it. I think, yeah, look, the reason was just carrying on from that message that I started off with at the beginning of my story. For me, choosing to become a speech pathologist was yeah, big passion of mine to work with people. And that's really what the industry brings. And for me, the most important thing is making sure that I'm going above and beyond for all of my patients and
Yeah.
clients and their families, and that no one ever is feeling like a number. So we always say we make the person the point. And that extends to our workforce as well, with our admin team and with our clinicians and to our leaders. It's
Yeah.
so important that everyone feels like they're the primary concern and the primary point,
Yeah.
because otherwise what really are we doing? So I guess for me that really was the catalyst and the inspiration to starting my business, is to making sure that every single person and their worlds that I touch has a ripple effect that makes them feel really significant and important, and that their outcomes really meaningful. And that to me was the number one thing. So yeah, I started that on my own, and I guess that message carried through to today.
Yeah. So how did you come up with the name?
It's actually my initials.
Oh,
It's nothing that crazy. Most people don't realize it, but
Yeah.
it's actually my initials. Yeah. So Gabriella Rachel Potasnik is my big fat long name.
Ah, that's the okay. That's where the because I was like, what could it be?
Yes, it's my middle name. Yeah, yeah. We were actually at the Disability Expo on the weekend, and everyone was asking me, and very surprised to find out that that's what it stands for. So yeah, that's what it is.
So, what makes GRP like different to other species? What makes you different compared to other people in your market?
Yeah, that's a really good question. And I think now more than ever, there's just, I mean, the Australia is saturated since the NDIS has rolled out. So I think it's really important to really articulate and explain how a company is different and how we stand out. And I believe that it's truly based on, like I said, the values that I've just mentioned around making the person the point. I think in speech pathology that a lot of speech the I mean, we won't go back in the industry, but a lot of speech pathologists, if they're listening, will
Yeah.
understand that at university, a lot of the curriculum is really focused on a medical model and an impairment-based focus. And that's that. But before I started GRP and started working in the disability space and pediatric space, that really was the experience that I had, especially in the public health system, where it's all about finding out what someone's impairments are and then labeling them as quickly as possible and then kind of just giving them the report and saying, see you later, this is what happens,
Yeah.
this is what not happens, and that's your trajectory and prognosis from here on out. But what I love about working in the disability space and in the community is that it's not about what you can't do, and it's not about your diagnosis. Obviously, they're important factors in
Yep.
considering a treatment plan, but that is the minority of the things that we're looking at. What we're really looking at is what someone can be doing and what their potential is. And I believe our true role as a speech pathologist is exposing someone's communication potential,
Yep.
leveraging their capacity and highlighting what they can do and celebrating the wins, big or small. And so in terms of what we stand for and how we stand
Yep.
out from the crowd is that we have a really functional clinical approach, which means that we do exactly that. We're not focusing on a diagnosis, we're not labeling, we're not trying to figure out how to fix
Yep.
somebody. We're working on what is important to somebody in their world, and that's what I think speech pathology is all about as a service. But as a team, that's everything that we also focus on with each other too, is empowering and uplifting everybody with their potential capacity. So I think that's how we strongly differentiate
Yep.
ourselves from the crowd,
So
and we're really proud of that.
so on the weekend you went to an expo which was kids based, but you also work with adults,
Yeah.
so you work between the two. So how do
Yeah.
you make sure that everyone's needs are met because kids' needs are very different to aging adults?
Yeah, definitely. And that's also another thing that we really pride ourselves on is that we do, as speech pathologists, we come out with such a variety of skills that we can help apply to so many different people with varying presentations, diagnoses, and also ages. And I
Yeah.
think it's a really important distinction and fact to really highlight because I think, again, in the industry, there's a propensity for people to really select whether they're going into working with kids or
Yeah.
adults or voice or working on the wards in public health. But I think I really like to challenge that. And that's what our workforce is also really known for at GRP is that we're challenging that narrative that you have to pigeonhole and you have to choose.
Yeah.
And so in answer to your question, which was is your question how we apply our skills to both
Yeah,
of to varying
yeah,
ages? Yeah.
because it's so different. Because the skill sets for kids is because it's growing and developing, and
Yeah.
then yet the skill sets for somebody that's aging is completely different because it is deteriorating. So you've
Yeah.
got an area that you're learning and another area that we're learning to um,
Yeah.
different.
Yeah.
Yeah,
Yeah. Yeah. So it's really interesting. And I think that's where it comes down to really focusing on the person. Because yes, there's children and adults, but if you're working with adults, for example, in the disability space, they might be presenting with something that they've had and carried with them their entire lives. And it's not about rehab and it's not about
yeah,
getting better, it's
yeah,
about leveraging capacity. So I'll give you a couple of
yeah,
examples, but for the one thing, when we're looking at something at functional goals as an example. So we're looking at the person's entire world and their family and what's going to make a meaningful difference in their lives.
yeah,
It doesn't actually matter what their presentation is, what their age is. it depends on, well, what is motivating them, what's engaging them, what's lighting them up inside. How do we build rapport with that person,
Yep.
and then leveraging that capacity to help them get everything they want out of the session. And in my opinion, it doesn't actually matter what their age is. It just depends. It just really matters that you're listening to what's important to them and how you're going to get into that
Yeah.
core level. But I guess on another way of looking at it, when I was, so I mentioned that I was working in public health, only
Yep.
working with adults in neuro rehab with people who had acquired brain injuries, which meant that they had an injury that really
Yeah.
changed the way that they function in day-to-day life. And that was really shocking for families and for the person. And at that point, it's really all about improving their
Yeah.
baseline, and it's all about improving things. And so I guess when I decided to have a bit of a shift in the way that I was laying out my career as a speech pathologist, I challenged myself to go into pediatrics from like 7 years of working in
Yep.
adults. So exactly like you're saying, I had that mindset. I was like, how can I possibly do this? All I've been doing is working with adults
Yep.
with acquired brain injuries, and now I'm going to work with little kids on the floor playing trains and Pokemon Go. And but what I've realized is that the skill set's actually identical.
Yep.
So when you're working with someone who's got slurred speech following a stroke or brain injury,
Mhm.
that's no different to the method and the hierarchies that we use for children who have articulation disorders or delayed
Yep.
articulation errors as well. Or when you're working with someone who, from a brain injury, has difficulty understanding and comprehending, it's
Yep.
no different to working with a child who has a global, like maybe a language delay,
Yep.
let's say. You're just changing the motivator and the thing that they're interested in. And so that's where you have to get a little bit agile and flexible. So
Yep.
I personally think that speech pathologists we do have the skills to help so many people, especially in a market where so many people are just screaming for us and to help them.
Yep.
I think it's time that we get creative and we can do it. And GRP is proof of it. So yeah.
So you, because with all the variety, and you've got actually, like, I did a bit of a head count, like I did a complete business store. You've got like nearly 30 staff members. How do
Yeah.
you monitor the success that your people, like your participants, have? Because you've got such a big team. How do you pick that? Like, how do you monitor success?
Yeah. I mean, are you asking about success with clients, or how do you
Yeah,
monitor quality?
no, we can do both. I'm happy for both. Oh,
Yeah.
I do want to know about the success that you get for the people that we serve.
Yeah.
Yeah, like, yeah,
Yeah, I mean, well, we'll start with that one. So
yeah,
all of our clinicians are really strongly trained by, we've got a fantastic leadership team that really monitors everybody's growth, their development from a clinical perspective as well as a personal perspective. And I believe that, oh, I always say a happy speech is a happy client. So making sure that we've got really strong supervision and leadership in our clinical team is critical. Everybody has check-ins and supervision scheduled in for at least an hour a week. We cross-check all the reports and do
yeah,
quality checks on everything, session plans, outcomes, and everything. But I think when you're looking at client outcomes, it's so important to have regular goal setting sessions. And so one of the things we do when we onboard a client is we do an initial consultation, understand what
yeah,
everybody's goals are, but then we'll also go through a goal setting process with the client and or their carer or significant other, and really determine what they want to achieve out of therapy and what's going to show that they've made a meaningful impact, or we've made a
yeah,
meaningful impact in their world. And so every 3 months we'll review those goals with the client, with the families, to make sure that they feel like they're getting something out of therapy, and that it's really changing their lives. And sometimes
yeah,
we see small incremental changes, and it might not be something huge to the outside eye,
yeah,
but to that person and to the family member, it could be as simple as sitting in a session, engaging in a reciprocal conversation for a minute. And
yeah,
that's an amazing thing. So the way that we measure success and quality is through having a really
yeah,
quality leadership team that's trained specifically to oversee the work that we're doing, but
yeah.
also from a clinical perspective, it's we have to be proving that we're making a difference in someone's life. So it's through those really clinically organized functional goals that we set.
So, the interesting part, and I don't feel like we touch on it much, is
Yeah.
that we always talk about the participant, but there's actually the family surrounding the participant that's learning as we're going along. I think for my son, who's had speech
Mm.
therapy, I learned a lot from it. I'm not quite sure what, like, he gained stuff, but I learned and I changed the way that I deliver information to him. So
Ah,
there is that,
yes.
yeah. So there is that element as well, because it's not just growing and, evolving with the participant that we serve,
Mm,
but it's also their families, their friends, their significant other.
100%.
So there's 100, yeah. I've seen it, and I've even, yeah, I've changed the way that I communicate with him. Yeah, just blocked out. You've dropped out your volume. Oh,
Gotcha.
gotcha. You're back.
Sorry about that. So
That's all
sorry.
right.
I've turned it right
So,
off.
oh, good. Do you know what we haven't talked about, but I think is really important, is for support workers. So, as a support worker,
Mm,
we get these speech assessments a lot, and
yeah.
by the fact that we have to follow them. And every now and again, I'll hear one person that says, "Oh, I'm not quite sure about that assessment. Why are we following it?" So, here, directly from the person, why is it important to follow speech therapy assessments and plans?
Yeah,
You can
absolutely.
be
So are
hard
you
on us.
referring,
It's okay.
are you referring, just so I'm clear, I'm
Yeah.
answering the question correctly. So are you referring specifically to speech pathology plans following an assessment?
Yes.
Y- Yeah.
Yeah.
Yeah, look, I think, I mean, it's hard to say what specific plans
Yeah.
you are referring to because every speech
Oh,
pathologist probably has different goals. So
yeah. Yeah.
don't hate on me, but I
No.
think, but from my perspective and from a lot of the work we love to do with support
Yeah.
workers is
Yeah.
that I definitely see support workers as a really critical resource to a client or a
Yeah.
participant's world, and almost as a communication partner and an
Yeah.
opportunity to, whether that's reinforcing strategies to help somebody's functional communication,
Yeah.
whether it's practicing strategies or whether it's practicing and reviewing the session exercises.
Yeah.
Ultimately, the goal is to enhance that person's well-being, quality of life,
Yeah.
ability to socially interact and participate in their world. And as you just said before, Sarah, being a mum of someone who's engaged with a speech pathologist is not just about the work that you do in the session. In
It's
fact, like that's
what you
hardly
take afterwards.
anything.
Yeah.
Yeah, it's exactly what
Yeah.
you do afterwards. And we know that, especially now more than ever, parents and family members are so busy. So
Yeah.
having a support worker as an adjunct to the support and resources that a
Yeah.
family might get is such a luxury. So going back to your question, I think
Yeah.
if you are in a situation where a participant does have a speech pathology plan or recommendations and strategies,
Yeah.
you're going to be really helping that person to reinforce their skill set and to practice and to learn and hopefully expedite that process for them so that in between sessions
Yeah.
you're giving them every opportunity possible to really thrive and grow.
Yeah.
So yeah, without that, I think it just slows down the
Yeah.
process. And yeah, another way I like to look at it as well, and this helps a lot of people,
Yeah.
is it's like learning a new language, especially when we're teaching sign language or using, assistive technology as well. That's another language for a person. So
Yeah.
there's only so much we can do in a 45-minute session, but to take that away, it's like learning a new language. If you don't practice it, if you're not immersed in it, if people around you aren't talking it, it doesn't stick.
Yeah.
So it's a
Yeah.
luxury to be in your position to be able to help so much in the way that you guys do.
Because in the beginning, when we're introducing new communication aids and such, it's hard for, it's not just the person learning, it's also the family learning. So it's like,
Yeah.
I'll give you an example. When Pro to Go came out,
Yes.
I had to teach myself that and how to work the board and how to navigate the board and change the board. It
Yeah.
is not something that happens overnight.
No.
It's something that takes time to build and grow as you go along. So what, when it comes to receiving all these, like the plans that we've got, we're working with somebody, what is the best way for a support worker to communicate with a speechie or your team to check in if something's working or not working? What is the best avenue for a support worker to communicate with a speechie, pretty much? Is it just emails or is it a phone call? Like, how
Yeah.
does it work? Yeah.
I mean, look, I can only speak on behalf of GRP
Yeah.
because that's where I'm coming
Yeah.
from.
Oh,
It,
good.
I'm sure, look, every different speech pathologist has different communication preferences. For us, it's really, yeah, email, booking a time in to have a chat.
Yeah.
Um, yeah, I'd probably say that, like, just like
Well,
any other person that you're engaging with, I think Communication's key. So definitely reach out. Usually speech is either on the road or in,
Yeah,
sessions. So email, we like to say email to make a meeting
yeah.
time, and then we love to help.
Because it really is a teamwork to make it to the very end to support somebody, because
Yeah.
the plans that you put in place, the sessions that you've got as support workers, what we bring to
Yeah.
the table when we're providing care to somebody, to the family, it is teamwork is a dream work.
Definitely.
So on that note, what is a idea or concept within your business that you're most proud of?
Yeah, I mean, you've probably said it best. Teamwork makes the dream work. Where I think, I mean, like you've just said, working in a team to get amazing client outcomes is
Yeah,
everything. So working in our multidisciplinary teams. But if we're talking about GRP specifically, we are an incredible bunch of speech pathologists, from new grads through to people with 40 years experience. And I
yeah,
think together with the collaboration and our passion and our really our strong desire to empower clients in the
yeah,
way that I mentioned earlier, that's something that I'm so, so proud of. And I think everybody in the team brings something different. Everyone
yeah,
comes from a different walk of life, a lot of different countries, actually. We've got a really
yeah,
diverse, multicultural team, which we're really proud of. Um, but yeah, I think for us, it's about really amalgamating all of our skill set and working together to collaborate and to make amazing memories together as a team,
yeah,
but also to build on our clinical skill set so that we're able to provide really literally
yeah,
award-winning opportunities for our participants and their families. That's
yeah.
definitely what I'm most proud of. Yeah.
Well, every time I have heard you speak in any session out and about, you've always spoken about your team in such high regards. How
Mm.
do you pick your team? Like, it's not a lucky dip thing?
Yeah. Yes, no, it's definitely not. It's definitely not. And everyone says at the moment speech pathologists are unicorns, and I can definitely agree. They're hard to find, but even still, I think we look for people that truly align with our values, and our value system comes off the word empower. And I know
Yeah,
I keep this, hanging that word around, but so for us, it's about empathy, positivity, wellness. What am I saying? Empower, empathy, equity, and respect.
yeah,
And so we're really looking for people that are bubbly and confident and positive
yeah,
and are genuinely in this industry and in this profession for the right reasons to empower people
yeah,
to reach their full potential. And I think we can really quickly tell. I mean, finding people to join our team is a lot of the work that and the time that I spend in my day now, and I can tell pretty quickly from a quick conversation if
yeah,
someone's got it or not. But truly, we look for people that really exude those that way of being. And that it's genuine, because if you've got that positivity, if you've got that bubbliness and that ability to build rapport, the client experience or the participant experience
yeah,
speaks for itself. So that's what we look for when we want people to join
yeah.
our team. It's
And
really
you're
about personality. Yeah.
you're 100% right. Happy people do really good work, and a happy
Yeah,
speechy will go that extra bit further. 100%, I agree with that.
I think
So, what
so.
do you wish people knew more about when it comes to speech therapy?
Oh, yeah, I think this is my favorite one. So,
Yeah,
um, so I always say that I think speech pathology was given the wrong name. It's
yeah,
speech pathology, but as you would know,
yeah,
in the disability industry, but even beyond the disability
yeah,
industry, even in public health, the minority of the work that we do has anything to do with speech.
yeah,
It literally does not. Like I would say a lot of the work that we do now more than ever is working with people who are non-speaking,
yeah,
and that's to me like the most amazing opportunity, because unfortunately people in our world these days make a lot of preconceived judgments, but then when you actually take the time to expose someone's
yeah,
communication potential, not through verbalization and not through speaking, but through technology or sign
yeah,
language or body language, and just sitting with the opportunity to get to know someone in a different way,
yeah,
it's amazing.
yeah,
And so I actually wish that our profession was named something different.
yeah,
I'm still not sure what that is. Something to do with communication as an
yeah,
umbrella term, but um, I think that's what I wish people would know, is that a lot of anytime I tell someone I'm a speech pathologist or
yeah,
we get inquiries about speech, they think that you have to be a speaking person
yeah,
to benefit. And I think that's where there's a huge gap in
yeah,
a lot of the industry knowledge, that we can really help someone even if they're
yeah,
not speaking. So that's what I wish that people would know more about speech
Yep.
pathology. That is, you don't necessarily need to talk to really benefit from a speech pathologist, and it's the minority of the work that we do these days.
I feel like one point that I, with support workers that I touch on is environment is key. And a lot of conversations that I've had that how important a family dinner is
Mm,
and to be able to
mm,
speak at family dinner what you did for that day.
yeah.
So it's about, as support workers, setting somebody up to be successful as possible. So whether it is at dinner, whether it is at with your family, your significant other, what is somebody's environment for them to
Yeah.
succeed in? So the idea that, yeah, what I wish people knew. And I think for support workers, for us, I wish that they knew that we can slow down and it's
Yeah.
okay to slow down and to change the environment so somebody can
Yeah.
succeed in
Yeah.
and communicate as much as possible.
Yeah.
And that's what we want. We want to hear. And the way that you choose to communicate, we're all for it and we'll go for it. But
No,
anywho,
that's no,
so
it's so true. So
yeah.
true.
Um. Oh, I like this one. You ready?
Alrighty.
For other um, speechies out there starting a business, what advice would you give them?
Mm. Um,
Don't,
I think
no.
I yeah, don't do it.
No, it's hard.
Look, I think it would be. I think speechies tend to be perfectionistic
Yep,
and they like to have all their ducks in a row before they execute anything.
yep,
And what I would say is that you should start before you're ready and just back yourself all the way
yep,
because everything falls into place. And if you're truly passionate and committed, and you're in this for the right reasons,
yep,
I always say progress over perfection. So you'd rather
yep,
start something than wait and miss out.
yeah.
And I think that's something that I've learned to really get on board with because no one ever really knows completely what they're doing and no one ever has anything completely down pat and ready to go. So yeah,
And we
start before you're ready
pivot.
and just get on it.
Yep. So, what does the future look like for GRP, and what are your hopes and dreams?
It's a good question too. Look, I think for me, it's all about being able to service our community in a really, really high quality way. And for as long as I'm able to do that in a way that's servicing more people, creating an amazing community, not just of
Yep,
participants and families, but also in the speech pathology industry and really advocating for that message of functional therapy. To me, that's what success looks like,
yep,
both in GRP and in our industry. But in terms of what the future holds for GRP, I think that is a foundation, but really harnessing other opportunities to help more people and different people
yep,
too. So at the moment, we really focus obviously in the private sector, but also in the disability
yep,
space, and we're so proud of the work that we're doing. We're working on a lot of projects at the moment in outreach community and
yep.
outreach programs. So working in Indigenous communities in more lower access areas. That's something we're about to kick off, which is so exciting.
Is that Victoria
Um,
based or
it's Vic
outside Victoria?
it's Victoria based, but we also have a telehealth team Australia wide. So
Yep,
we're really hoping to expand that into not just Victoria, but wherever there is need and think really innovatively and out of the box for that, so that people that do have the need but can't find speech pathologists to go into the middle of the desert or the middle of
yep,
anywhere, that we're able to help those people and think really creatively for them. So that's one thing I love, giving back to the community and thinking of ways that to do things that other people aren't doing in a creative way. Um,
how do you
so yeah, the
think
out.
of these ideas? Like, how did they come to you that, hey, like, are you just like in the middle of the night, going to get a notepad and pen out? Like, how
I
do
mean,
you
that
come up with
happens.
them?
No, that definitely happens. But I think it's just about thinking that what I realize is that speech pathologists like to live in nice areas. We all know that, and but Australia is a massive country, and there's lots of people living in areas that have lower access to public health and lower access to support services. And so when you really dig into it, I mean, I don't really know how I come up with it, but I guess just in the work that I do, you hear about people that are really
Yeah,
struggling to find services. Um, and I've never been of the belief that you can, pay someone that much more to live in an area that their family and friends don't live in. It only lasts so long,
yeah,
where people are satisfied. So I think there has to be other ways to get the message across and to help support people. So living in a world of technology and amazing opportunities, like we did it through COVID, why can't we continue that now? And
yeah.
so I guess that's where the outreach program comes from. So I'm, yeah, I guess really been for a long time trying to speak to people in the community and the right people around how we can support services in a different way, and
Yeah.
not just trying to kick the can down the road with the same approach, which isn't
Yeah.
working. Let's think differently about it. So, yeah, that's something I'm really excited about. And yeah, different forms of community outreach. So also another really cool thing we're working on is working with people who are coming out of jail, which is a little bit
Yeah.
controversial for our industry, but it's amazing. It's really cool that we're able to again be really innovative, and use technology to work with people that a lot of people don't want to work.
Yeah, but then you look at it now that the way that we diagnose people, there's more out there than ever before. Your thing's gone. Yep. Yep, you're back.
Oh, we're back. I'm so
Yep.
sorry. That silly timer keeps on cutting me out. Um, Sorry. It cut.
Oh, good.
Yeah. But
Oh,
anyway,
good.
that those are my hopes and dreams for now.
Yeah.
Staying, yeah, growing
Yeah.
and really high quality, and thinking of all the out of the box opportunities to continue to support our community where they really need us.
Yeah.
Yeah.
Now, one part I love to touch, the best thing that I love about support work, and then anybody that's been in a sector where we manage support workers, one of the best things is that we get a lot of students that come in that start their careers as support workers
Yep.
and then go on to study speech pathology at uni. Have you
Yeah.
got any advice for anyone studying currently that's looking to get into this sector or to connect with you
Mm.
for future employment?
Yeah, yes, please come to us. Yeah, well, I mean, that's really interesting. We actually have, so we've got a 2-year new graduate program, but also we're connected with all the tertiary
Yeah,
institutes in Victoria, and we have affiliations with them. So we will facilitate student placement. So we get to see all
yeah.
the up and coming speechy talent, which is lovely. But any advice for speech pathologists coming into the industry? Yeah, do it. We need so many more of you guys.
I love it, to be honest. Like, I love getting students, with also like teachers and physios. I've had a variety of people that have come through our sector through
Yeah,
support work, and I feel like um, we're a part of the career that helps them grow into their sector because the skill
yeah.
sets that they learn as support workers is so important to be able to bring into being a speechy. Yeah,
I
100%.
completely agree. And actually, when we do our new graduate interviews, which is now usually a year in advance, and we see that someone was either a support worker or an AHA
Yeah,
um, during university, it firstly, like, that's really impressive. I think that shows really great initiative. And it also shows that you understand our industry before you've even started
yeah,
working in it. So when we actually, I mean, we just love speeches that have that background.
yeah,
But also we find that the speech pathologists that are coming out with that foundational knowledge and experience are so much better as clinicians for it. So
yeah.
thank you to our industry for making our speeches even better.
To be honest, I enjoy it because you get to see somebody start off like before they've even started uni, before the uni break, they're 18, they've come into our sector,
Yeah.
and then I felt like I get to grow with them as well and grow their career, and then I get to
Mm.
see them succeed as being speechies and physios and also all crazy things in between. That's
Mm.
cool. Like I really do
Yeah.
love that part. So, if you could go back in time, what would you tell your younger self?
I mean, probably what I said about starting a business. Just like
Why
do
not?
it. Just yeah. I think and I probably could have started 2 years earlier than I did, even though I started like 9 years ago now. But
Yeah.
I, I wish I did it earlier
You
as
know
well, because
what?
yeah,
People say that. So many entrepreneurs say that. Like, why did I wait so long to
yeah,
start? Because this is the epitome of being quite happy and enjoying what you're doing. And then you wake up every day knowing that at the end of the day you're the boss. So if
yeah,
you stuff it up, it's all on you. And yeah,
which
yeah,
is
right.
great too. It's
Yeah, because it
fantastic.
does give
But
you that energy. Yeah,
yeah, yeah. So definitely, I think I was looking back. I was like, oh, well, I don't have a website, and I don't have this. And to be honest, I didn't have a website for the first 3 years of my business. So,
yeah,
um, yeah, I think just jump in and do it. You'll
yeah.
figure it out.
So what keeps you going on some really hard days? Because you do have people that we serve that come from a variety of different backgrounds, and not all of the stuff that happens for them or to them isn't great. So how do you manage hard days?
Yeah. Yeah. That's a good question. There's lots of hard days as a business owner, as
Yeah.
I'm sure you're aware too,
Oh,
Sarah. Look,
I
I
do it
think,
for the thrill.
oh yeah, it's a roller coaster ride. It's like, yeah, tower of terror
I
every
don't
day.
regret a thing, but it's best thing I've done.
Good, good. Yeah, same me too. I think I think it ultimately comes down to the ripple effect that you create in people's worlds.
Yeah,
So knowing that even though I don't, I've got one client that I've been seeing for 10 years now and who I
yeah,
adore. I don't work personally clinically, but knowing that the business that I lead and the team that we work with are doing such incredible things every single day that have a ripple effect, like we're talking about, not just in their world,
yeah,
but in their families' lives and their carers' lives and hopefully all the other people that they're impacting and inspiring every
yeah,
single day. So for me, what it always comes back to is the amazing work that we're doing for people and their families, as hard as it is sometimes. And yeah, and I love it. I
yeah,
think beyond the participant and the clinical work, it's also about working, like I said, as a team, and working with really amazing human beings
yeah,
that are equally as passionate about our mission and our values
yeah.
to empower everyone to reach their full potential. So I think it's comes back to that, and it feels pretty good, even when it's a crappy day and a really challenging day, or there's always things that pop up. It's nice to know that it's always at the foundation of the amazing work that we do.
So if anyone wants to connect with you, whether it be a NDIS participant, whether it be somebody studying at current, family members, what is the best way to connect with you and your team?
Yeah. Thank you. So, if it's an NDIS participant or family member, or if you've got any referrals for us, we do have some immediate capacity, by the way, in some areas. So, if you're interested, basically, I would say go on our website. We've got a referral form there under the how to refer section.
Yeah,
Otherwise, and the website is www.grpspeechpathology.com.au. You can also contact us via email. There's a form on the website, so that's also a really nice way to be in touch.
yeah,
And of course, there's our phone number there too. If you would like to reach me personally, which I'm always happy for a chat, if you're a speechy and we're currently recruiting, so I would love to chat to you too. Or if you just want to have a chat, LinkedIn's my best or your best bet. I'm always on there, so
yeah,
just send me a DM
yeah,
on Instagram here as well.
yeah.
Yeah.
Perfect. Well, as we're evolving and moving, you are with your Instagram is completely different to your LinkedIn. Your Instagram is
Mm.
very much showing your beautiful
No.
self, and
Oh,
LinkedIn is more for your, I take it for your team to get involved
yeah.
because I remember having a chat with you saying that, what I love about Instagram is that everyone gets to see beyond the therapy that we're doing, that they actually get to
Yes.
see the team, which is really
Yeah.
cool.
Yeah. Yeah, I think there is, yeah, it does look a little bit different. So we really like to use Instagram as a platform to show off our team and all the
Yeah,
fun that we have behind the scenes, the connections that we make, and some of the really cool success stories of, the clinical work that
yeah,
we do and all the growth and clinical learning that we have in the team. So for us, it's about showcasing our culture and having fun that way. And whereas, yeah, LinkedIn is more, yeah, more I guess about networking for
yeah,
me. I've got my personal page, so it's a lot about who I'm meeting and the things I'm
yeah.
learning and things I like to share from a professional business perspective. And then we've got our LinkedIn page as well for GRP Speech Pathology. So
But
that's a similar to our Instagram page
but
too.
you also do public speaking and you're a panelist. You do a lot. How do you
It's
keep on
24
top of all
hours.
this stuff that you do? Are you
I
tired?
am tired. Yeah, I'm really tired. I go to yeah, I go to sleep when I can. I have a little micro nap. No, yeah, I do. I cram a lot into my 24 hours. I
Yeah,
love it. I'm a little energizer bunny
yeah,
until like every few months I crash and burn, but then I get back up. It's fine. But yeah, no, I love sharing. I love sharing knowledge. I love meeting people. I
yeah,
love um yeah, empowering our industry to think differently and to think big. Like I
yeah,
said, both clinically, but I love speaking to other business owners and other women in business and men in
yeah,
business, um, because I think that's what it's all about. I think it's so amazing to be around really inspiring people that
yeah.
understand the challenges and understand the joys of running a business and a team. And yeah, I love learning as much as I love sharing. So for me, It's a pleasure. And
100%.
yeah, I love it.
Well, that's all the questions I have for you tonight. Is there anything else I have missed that you'd love to talk about? Because I'm all ears, like I'm nosy.
I mean, you can ask me anything else, but I mean, no, there's nothing else that I
I
had on
pumped out
my mind.
at least, what was it? It was probably, I think, 24 or 25 questions.
Cool. Okay. Well,
Oh,
it
purely
felt
from
like a nice
stalking.
conversation. It was easy conversation. So
Yeah,
thank you.
that's all right. Oh, good. Well, that's if anyone else in the comments has got any questions, go ahead. This is your chance to shine.
This is my first Instagram live, though. I've always
You've
wanted to say
done
that.
really
I've never
well.
had an Instagram live before, so thank you for
I
having me
think
and popping my Instagram cherry live.
I enjoy them. Like I do. The best thing about lives is it's real, like, and people see
Can't
that.
edit
And I think that's the
it.
most, yeah, you can't edit it. And it's raw. And that's what I enjoy about this business because work and being in this sector, you have to be raw and you have to be
Yeah.
upfront and you have to be present and you have to be you.
Mm,
That's the best way forward.
yeah.
So, yeah. All right.
Well, thank you so much, Sarah. It's
Thank
such a
you.
pleasure
Thank,
catching up with you again. Thank you
we
so
will
much for the
catch up in the
opportunity.
future for sure.
Please, I would love to. I would love to. Thank you so much,
Right.
Sarah.
See you,
Have a
mate.
lovely night.
Yeah, bye.
Bye.